obviously gallstones are extremely common in the world. I mean, in places like the cow belt in the northern part of India, where UP, Bihar, West Bengal, that area, the incidence of gallstones is so high that it's almost 1 in 10. So 10% of the population has gallstones. So the burden of gallstone disease is huge. And in that, a lot of patients have asymptomatic gallstones. So just gallstones, when you undergo some test or something, you find you're found to have gallbladder stones. So, and you don't have any symptoms attributable to the gallstones. So, what do we do for these asymptomatic gallstones? So, for these, a lot of studies have been done, and we have clear-cut scientific data about this. So, in some of the studies, they've studied up to 40,000 patients over a period of 30 years. So, 40,000 patients with asymptomatic gallstones, they followed them up for 30 years. And after 30-year follow-up, out of the 40,000 patients, only 10% develop symptoms. That is, 90% of the patients, even after 30-year follow-up, did not develop symptoms. The other problem with gallstones is patients with symptoms can have complications. So, if you have symptom, that is the pain which I described, the sudden onset severe pain is called biliary colic. If the patient has an episode of biliary colic, he is at risk of complications. So, the complications are the stone can get obstructed in the neck, cause acute cholecystitis, it can cause pus in the gallbladder, it can cause gangrene of the gallbladder, it can cause perforation, it can slip into the bile duct and cause jaundice, it can cause infection in the liver called cholangitis, it can slip down into the pancreas and called pancreatitis. So, all these pancreatic problems, so a person with asymptomatic gallstones may worry, because all these complications are pretty serious and they have very high risk. So, one of the concerns is, I may not have symptoms. What if I directly get a complication, which is a life-threatening complication? So this has also been studied. So over 30-year follow-up, 90% of the patients did not develop symptoms. Only 10% developed symptoms, and only 1% developed complications. So out of 100 patients, only 1 patient developed complication in 30 years of follow-up in asymptomatic gallstones. So, and the most of the time, it was found that the patients who developed the complications had an episode of symptom before. So, the standard dictum is that if you have gallstones and you have no symptoms, there's a very likely, there's a 90% chance that you may never get symptoms ever in your life. So, you need not have treatment and you can just follow up. But once you have a single episode of symptom, if you have a single episode of symptom, the risk of these complications, acute cholecystitis, gangrene, perforation, cholangitis, jaundice, pancreatitis, some of them like pancreatitis and cholangitis are a pretty high risk conditions with almost 20 to 30% mortality. So, if severe pancreatitis. So, if you have once you have symptoms of gallstones, the typical biliary colic which I mentioned, the risk of these complications is 4 to 8% per year. So, once you have symptoms in the next 10 to 12 years, you will inevitably develop a complication. So, treatment is mandatory. If on the other hand, if you are asymptomatic, there's a 90% chance you will never develop a symptom, and if at all you develop a complication, before that you will get one episode of biliary colic. So, based on these recommendations, in the Western data, especially where the healthcare is mostly government sponsored, so the way they looked at it is, so let's say every in the US or UK, gallbladder surgery would cost, let's say, about $30,000. So $30,000 into 100. So that will be like, $3 million to prevent one complication, because only one complication occurred in so much. So based on that economic model and also the common sense, because we are doing a lot of unnecessary surgeries, it is recommended that patients with asymptomatic gallstones need not undergo surgery, but if they ever have an episode of pain in the waiting period, they should immediately go for a laparoscopic cholecystectomy.